This is dangerous stuff. It will kill you.
A lot of these patients are not breathing at all, and they're right on the verge of death.
People die the first time they try this drug. It's not like you have to use it a certain amount of times and then you could possibly overdose and die.
Fentanyl is 100 times more powerful than morphine.
Fentanyl is such a deadly drug, and the human body can only take small amounts when you're in a medical situation and doctors are there. When you're not, you're gonna die.
We are on pace to have 100 opioid overdose deaths in this county this year.
An estimated 200,000 people, the equivalent of Akron's population, are now addicted to opiates in Ohio. 200,000.
We have a heroin and opiate epidemic in this county.
I can tell you, in 2012, Lorain County had 22 overdose deaths for the entire county. We're in July of 2016, and for the year 2016, the city of Elyria alone has had 22 overdose deaths. And the county is going to be much, much higher than that. We've had 84 overdoses in Elyria in 2016, and 22 of them have resulted in a death. That's over 25% rate, and that's with Narcan being out there to try to save the lives of the people who are overdosing.
30 years ago, the heroin user was the bum that lived under the bridge. Today, the heroin user is the 17-year-old girl from Grafton. It's a 25-year-old mother from Rochester. It's the 40-year-old professional in Elyria. This stuff absolutely does not care. It is addictive without regard to race, creed, color, national origin, or income level.
One of the major reasons we're having a sharp increase in overdoses and overdose deaths is that drug dealers are mixing fentanyl in with the heroin. Fentanyl is a very, very dangerous and deadly chemical just by itself, and you mix it with heroin, it makes it worse. So when people are injecting what they believe to be heroin into their body, they're really injecting a mixture of fentanyl and heroin, and it's having deadly effects on them.
Heroin, that's usually what they use. It's the base of whatever we go to, but now we're seeing this huge fentanyl influx. Okay, and fentanyl is 100 times more powerful than morphine. Okay, and now we see this 3-methylfentanyl coming in, and that's 7,000 times more powerful than fentanyl itself. This stuff, we have to give almost up to 10 doses of Narcan. It's like they're fighting us. If you do that, I mean, you probably will die.
The opioids especially, whether they're prescription drugs or heroin, have a severe effect on the desire to breathe. And it completely saps the body of that desire to breathe. And so these people are very sick when they come in. Unlike overdoses from other drugs where they may be asleep or unconscious, they're still breathing and they still have a heartbeat. A lot of these patients are not breathing at all, and they're right on the verge of death when they land on our doorstep. They arrive in two different fashions. Either we get a call from EMS that they're bringing in an unresponsive patient that they're attempting to resuscitate, or often, and unfortunately, these patients are dropped off at our doorstep by people that want to remain anonymous. And they'll kick these patients out onto the curb, and they hope that a nurse or somebody from housekeeping or security happens to see these people laying in the driveway, because they're often not breathing. And as you know, that the brain only has a few minutes to receive oxygen before brain death occurs. So those people, when we find them on the pavement in front of the hospital, are the ones that are generally the sickest and need the most emergent care. We see it several times every day, and that's really sad, and that is new within the last 5 years. This used to be a very isolated situation.
Typical overdose scenario, we usually see it a lot in public areas, out in parking lots. People don't want to be around other people. They do it where they seem like they're secluded. So we do see it in a lot of public areas. We show up on scene, usually unresponsive, apneic, they're not breathing, because that's how people overdose. It kicks out the respiratory drive, being a central nervous system depressant. And with enough time, the heart follows. And so we usually show up, they're blue, look real bad. A lot of people call them in, actually, they think they're already you know, they've already passed away. But usually that's not the case. They still have a heartbeat, and we just got to bring in so they can start breathing on their own. We bag them first things first. You know, we go in there and we actually have to artificially ventilate these people, and then we give them Narcan, brings them out pretty quickly. I would say any day now we usually get about 2 to 5 a shift a day, and that's the highest it's been in a long time. The busiest, it seems like it's just everywhere, and they're becoming, you know, a little bit more clever with what they mix it with, and it's almost like they're fighting us. The easier we can fix something, the more they mix it with stuff we can't fix.
This is a drug called Narcan, and the generic name is Naloxone. And this is a drug that's been around for a long time. And EMS people have carried it, but EMS people are allowed to give medications. Law enforcement officers were not. So we got the law changed that said the cops can carry this. And what this does, and please don't ask me a whole lot of scientific stuff because you're going to get way out of my comfort level in a big hurry, but this almost instantaneously reverses the effect of an opioid overdose. And it literally, it won't bring you back from the dead, but it'll bring you back from 97% dead. And it throws your system into an immediate withdrawal. And instead of thanking you because you just saved your lives, most of the time these people come up and want to take a swing at you because you've ruined their really wonderful experience. And I'm not saying that sarcastically, I'm saying that absolutely truthfully. So we've carried this, and our 2 hospitals, the first time around, stepped up, and they said, we'll provide this, we'll pay for this.
In October of 2013, I received a phone call from Coroner Evans asking us to participate in Project Dawn. Project Dawn was a program where first responders, firemen, policemen were provided with Narcan to administer to patients or public who they found unresponsive to opioids. We were asked to provide Naloxone to the police departments. Since October 2013, we've been providing product free to all law enforcement in Lorain County, in all villages, and including we've been making efforts to help the law enforcement in western Cuyahoga County. Normally in the hospital, when we administer Narcan or Naloxone, it's given through an IV vein. However, because of the properties of the drug, we found out that it can be absorbed in the nasal passages or the vessels in the nose. So in order to ease the administration and administer to the patient quicker, we apply it through the nose. We use a product called a mucosal automatizer device, which makes a fine mist which can be absorbed in the nose, similar to a nasal spray that you would buy in a pharmacy. Very simple to administer. You open the box at the end. It comes in 2 parts. You flip the ends. They're screwed in the containers. You flip the top off. And then you administer the device. What the device does, it causes a fine spray. What we do to administer the patient then, we administer half in one nostril, and then we administer the other half in the nostril. And the device, like I said, makes a fine spray, which it makes it easily absorbed into the nasal blood vessels, and then it gets into the body system.
When we started in 2013 with Narcan, and we were the first county in Ohio for law enforcement people to have it, the EMS folks have had it for a long time. But when we got it, we said this is going to really turn the tide. And in the 2.5 years since its inception, we've saved 150 lives. And when I say we, I mean law enforcement. And we're really, really proud of that. But it has not cut that death number at all. We're still in the mid-60s. And in fact, if our current numbers hold true, we're going to be at right around 100 at the end of this year. So we have not stemmed the tide. I mean, we've done some really good stuff and we've saved some lives, but it's not getting any better. And this is a public health crisis, not only in Lorain County, but I think it's nationally. It's certainly everywhere in Ohio. The people that we talk to that do the same kind of work that we do. And it's just absolutely amazing how this has taken control of young people's lives. You should not bury your children. And we see this every week. You pick up the paper, you read the obituaries, and it says Joe Jones, age 22, died suddenly at home. 22-year-olds usually don't die suddenly at home without a very apparent reason, like a car crash or an industrial accident or something like that. So as soon as I read that at 6:30 in the morning, I said, I bet you that's going to be a heroin overdose, and more times than not, that's what it is.
After doing some research and looking through his room and finding evidence, we realized that he had indeed been messing with drugs, illegal drugs and over-the-counter, abusing them. And that was about when he was just turning 14. His first drug rehab inpatient was 15 and a half. And unfortunately, we lost Ryan July 2nd, 2013, when he was 24 years old.
Everybody kind of assumes that overdoses come from intravenous action, how they deliver it, but people just snort it now, ingest it, and they're overdosing just as much because it is so much more powerful these days. It's at the point where you really have to have almost a death wish to even try this stuff these days. And there's not too much we can do, and we see a lot of tragedy, and it's very sad. So I guess don't do drugs, really is the bottom line,
This is dangerous stuff. It will kill you. And I'm not trying to hit that too hard. I say that because I mean it. And what I say to parents is you need to talk to your children. You don't need to lecture to them, but you need to tell them. Everybody at 15 thinks they're invincible. I did, you did, this gentleman with the camera, we all did. This stuff will kill you, and it doesn't care that you're 15 and have a wonderful life ahead of you. It really doesn't care. And the last thing you do is say a prayer for your kids every night. That's all you can do.
Anyone even contemplating doing heroin, you have to realize that the first time you use it, you can become addicted. It doesn't have a magic number as to how many times. It doesn't discriminate. It doesn't matter how old you are, how young you are, what race you are, what religion you are. It doesn't matter. If you try it one time, chances are you will eventually either go to prison because of it, or you will die from it. There's really no in between. Every day when I look at my son's urn and I look at his picture and I cry every day, and his dad cries every day, and so does his sister, it just takes away the joy that life should have. As a parent, to know that you couldn't save your child is a horrible, horrible feeling. You don't realize how many people you are affecting when you use drugs, and especially when you pass away from them. And like my story has always been, my whole goal has always been, if you don't try it, you don't have to find out. So as a mom who doesn't have her son here, I beg you to be strong and to not ever, ever even attempt to use it. If you see people using it and that's what they think is the way to go, you don't have to be part of it. You can walk away. You can be the stronger person. Matter of fact, what would be nice is if you would try to talk to them and explain why they shouldn't do it.
Let's listen for a heartbeat. Do we have a heartbeat?
I have
no
no pulse.
heartbeat, no pulse. I think we should call it.
Okay.
Let's stop. No vaginal breaths. All right, let's go get the family. Talk to the family.
So time of death, 9 o'clock?